Welcome to Orange County Power Players, where we spotlight the personal, professional, and financial success stories of OC's top leaders. Here's your host, Danny Flores.
Welcome back to OC Power Players, where I interview some of the most successful people in Orange County. I'm Danny Flores, your host, and today's honored guest is Dr. Alva, zooming in from Boca Raton, Florida. Dr. Alva is a medical director of ATP Clinical Research, a premier private clinic research company specializing in neuropsychiatric investigations. He is an associate professor in the Department of Psychiatry and Human Behavior at the University of California, Irvine. He is a forensic psychiatrist consultant for the Orange County Superior Court and a diplomat of the American Board of Psychiatry and Neurology. Dr. Alva received his medical degree from the Autonomous University of Guadalajara. Residency training was completed at the University of California, Irvine Medical Center in the Department of Psychiatry and Human Behavior, where he served as a chief resident during his final years of residency. Dr. Alva has served as a principal investigator for the past 10 years, conducting investigation in a myriad of neuropsychiatric conditions, Alzheimer's and other dementias, depressions, anxiety disorders, bipolar disorder, and psychotic conditions. As a clinician and investigator, Dr. Alva's focus is on genetics, neuroimaging, and the latest treatments available for each aforementioned condition, as well as aspects of ethnicity and the correlation within clinical situations. He has published numerous articles and presents both national and international meetings and conferences. Welcome, Dr. Alva.
Well, thank you for having me, Danny. It's a pleasure being here with you.
Absolutely. So how did you end up doing what you're doing? How did you decide? Did you know exactly what you wanted to do as you were tracking your career early on?
Well, that's an interesting question, Danny. Some of us were actually born to do certain things. I knew ever since I was a little kid that I was going to be a doctor. I didn't know which type of doctor. And, it's one of those things where I was certainly on a mission and didn't deviate from it. So I'm blessed. I'm very fortunate. I get an opportunity to help out a lot of people. And I'll tell you what, my dream obviously came true since I now help serve a lot of individuals. And I feel very blessed for doing so.
Wow, that's amazing. I imagine the community is also blessed to have you being able to help them out as well. So that's always, having a place to go when you need some type of help is always super helpful. Now, tell us a little bit about what you do, the type of ailments you see and you try to help, and then maybe a little bit of the causation behind that, or symptoms that some people may not know that they maybe should reach out for a little bit of help.
Yeah. So I am a dual boarded psychiatry neurology practitioner, right? So I'm what you would call a neuropsychiatrist. I've been involved with a lot of investigational research work over time, over the past close to 30 years now, investigating new treatments for Alzheimer's disease, Parkinson's disease, movement disorders, problems that are very common, like major depressive disorder, generalized anxiety, bipolar disorder, which oftentimes mimics unipolar depression, schizophrenia, very serious illness, and sleep disorder. So a whole gamut of different conditions, right, Danny? And I got very, very deeply involved in this particular field because originally I was being groomed to be an orthopedic surgeon. And then about 30 years ago, one of my mentors hit on my hubris, meaning that I've always thought very highly of myself and made mention that the most serious conditions that we don't have cures for right now are those conditions that assail the brain. And so at that particular point in time, the University of California in Irvine, which is where I trained, had just become a very nascent area for genetics and functional imaging and new drug development. And there was a confluence of really amazing talent. And so I just thought, wow, I'm going to shift gears. So forget the whole orthopedic surgery route. I think I'm going to go into neuropsychiatry. And I'll tell you what, I've never looked back with regret at having made that decision, because it's, again, very rewarding when we help out so many different individuals. To give you an example of one of the more common problems that we see, major depressive disorder hits about 1 out of 5 Americans in the US, right? It's a medical problem just like any other, but there's still a lot of stigma associated with mental illness. And so as a consequence of that, people don't seek out help when they should seek out help, right? And if somebody for longer than 2 weeks has been feeling down and out, and they're lacking energy, they're lacking interest in things, they feel like they can't concentrate, focus, their sleep shot, their appetite shot, their sexual appetite shot, they're not feeling good about themselves, and they're having dark thoughts like suicidal thoughts. Well, that's clearly a harbinger of this serious medical problem. And it's easy to deal with it so long as it's dealt with appropriately. But the problem is that there's a lot of people that don't know that they're supposed to ask their doctor for help with things like that. So on the 10th, 4 days ago, was mental health awareness day, right? And there are different types of days throughout the year that help educate the public about common themes that are out there, right? Now, obviously, we can go into each one of the different conditions that I treat, but that would entail multiple hours, and I think that you would think that I was grandstanding. But the most important thing to your question, Danny, is that I get an opportunity to serve a lot of people within our community, within Orange County. I lead a center of excellence in the city of Orange called ATP Clinical Research, where we have an abundance of, again, studies that are free, that if somebody wants to take advantage of the different studies that we're doing, and they're more than welcome to come in and actually seek out the latest and best for depression, for schizophrenia, for bipolar disorder, for Alzheimer's disease, for Parkinson's disease, for Lewy body dementia, for tardive dyskinesia, for insomnia, for generalized anxiety, for PTSD, the whole gamut of things. And we're in a really fascinating time right now. We are, believe it or not, working with psychedelics, for example, in a controlled manner. So not just haphazard, but when people talk about psilocybin or LSD or MDMA or other types of psychedelics, there may well be a truly medicinal way of tapping into these particular substances, or again, molecules. But that's what I do. That's what I study. So I'm literally, through the investigational research work that we do, we're typically about 7 years ahead of the crowd and help with the development of newer treatment options. But I also, on a daily basis, get an opportunity to take care of and treat patients. And I work within a multidisciplinary team of neuropsychiatry specialists called Pacific Neuropsychiatric Specialists. My brother, Dr. Alex Alva, happens to be the CEO of that particular group. You'll have to have him on your program in a future podcast, but he can give you a little bit more about the clinical side of things. But I get an opportunity of bridging some really neat stuff.
No, that's super interesting. And you mentioned your brother. For some reason, I know you mentioned him in the beginning. I almost think I may have already interviewed him because the name sounded familiar. And before I started the interview, I was like, this just deja vu, but maybe I may have. You know what? I may have. So
Possibly,
when you talk to him, it's like I was trying to figure out in my mind, am I like going crazy here, or like, darn, help me here, Dr. Alva. So you mentioned a handful of things that are interesting. You say that 1 in 5 people. That's a lot of people that are walking around with the
major
need
depressive
of something.
disorder.
Yeah. And it's just like not just thinking about, oh, today I'm having a bad day, or I feel bad, and maybe it's for a week. So somebody who is listening, right? Because that's a lot of people. So we're going to be able to reach a lot of people that potentially need help with this.
Yeah.
So the question is, let's just say I'm going, and you said all these things that, the lack thereof, right?
Yeah.
Desires, maybe appetite, maybe
Yeah.
going out, maybe, like the sexual desires,
Yep.
maybe work wise, you're just not feeling
Yeah.
energetic. So if somebody feels this for an extended period of time,
2 weeks or
2
longer.
weeks, that's the ticket, right? To be able to go back and think, okay, wait a minute, maybe I should reach out to help,
Yeah.
to talk to somebody, right? I don't know what it
Yeah.
is. It's just not,
Yeah.
because sometimes you think, well, it'll pass. I'll be fine. I'll bounce
Yeah.
back, but maybe you
Yeah.
don't bounce back quick enough.
Yeah.
Yeah.
Yeah. No, those are great points, Danny. So the key thing is, when in doubt, seek out your medical doctor, right? Seek out your primary care doctor. They'll be able to actually guide you down. Hey, go see Dr. Alva. You know what? He might actually be able to help you out with this, or they
Hmm.
might be able to deal with it themselves, right? So, like I
Hmm.
said, there are very treatable conditions that, because people have been feeling embarrassed to talk about, they
Hmm.
don't. And then subsequently they suffer in silence, and there's no need for that. So,
Right.
again, if you're not able to work, if you're not able to socialize, you're not able to engage in doing your domestic chores, it could be because you have a big, serious problem that requires medical intervention.
Hmm.
And if that's the case, then get the appropriate treatment that you need. Because, by the way, we don't just use medications, right? There's talk therapy, which can be very useful. There are neuromodulation types of therapies, including repetitive transcranial magnetic stimulation, vagal nerve stimulation. There are different types of therapies, including intranasal esketamine, intravenous ketamine use, that might help individuals that have very difficult to treat depression, right? And so
Hmm.
there are different gradients of the illness, and that's where having specialists at one's disposal can be very, very useful. Now, just remember, every single medicine was once a clinical trial. So every
Right.
medicine first has to be vetted as being effective and safe by the
Mm-hmm.
Federal Drug Administration.
Hmm.
Well, a lot of the work that I end up doing is just that, right? And so that's kind of nice, because when somebody comes in to see me, they not only get the menu that they would be offered at any
Hmm.
other, clinic, but
Right.
there's also a
Right.
secret menu. It's kind of like, if you know what to ask for it in and out,
Yeah.
you're,
Oh
you're
yeah.
gonna get you're gonna be getting a whole secret menu, right? Well,
Right.
that
Right.
secret menu for me is the availability of the clinical trials that we do. So it's kind of nice that within Orange County, we
Right.
have the availability and the ability to be able to offer that within our community. And I'll tell you, Danny, I'm pretty much a product of the OC, right? The Orange County
Hmm.
area. So this has been home for me since I was a kid. So, it's like, it's been an incredible place to live. And as our dad once said, you got to give back to the community that you live in. And so that's one of the things that we were raised with. And I feel very serious about making sure that, all the blessings that we've received, that we're, again,
Right.
sending forward again back to our
Give
community.
back, right? Yeah. No, that's 100%. And that's just not in what you do
Always.
and what I do. And that's what we all should always consider, that society is what helps us rise, from their contributions to whatever services we provide. So we got to be able to reach out and say, hey, you know
Yep.
what? You guys took care of me. Let me take care of you back. That's a super noble and generous way to give back to our community, basically. Now, you talked about
Right. Yeah.
psychedelics, and I keep hearing that come up. I don't
Yeah.
know much about
Hmm.
it. Um,
Yeah.
People, that have tried it in controlled environments, is it something to help somebody who's in need, or is it
Yeah.
something to
Yeah.
also maybe you don't need help in a sense, but to kind of change the way you think? How does that work? And
Yeah.
how does that get
Well,
applied? I hear.
you just hit the nail right on the head, and that is that, you know, um, again, this has to be done in a controlled manner, and
Mhm.
it has to be well studied through, right? So
Right.
I would not advocate for people going out and microdosing and experimenting themselves. That's dumb. Don't
Right.
don't do that, right?
Right.
But
Right.
again, if you're interested, and for example, You've suffered with major depressive disorder that's difficult to treat. You've suffered with PTSD. You've suffered with generalized anxiety. Well, psychedelics may actually be a way of allowing your brain to reframe, right? So
Right, right.
reset, and then allow you the opportunity to then all of a sudden, kind of like get everything kind of redialed in, so that
Right,
your
right.
focus now and your perspective differs than what it was previously, right? So
Hmm.
again, this is an area that we are studying, and I feel like there's a lot of upside in this, but it has to be done responsibly and right. And that's why, again, I would not advocate for, people going wherever and experimenting themselves.
Right.
That's a great way of goofing yourself up, right? But
Yeah.
again, part of what we are doing is we're trying to figure out, how much, what it does, what's happening in the brain. And then that way we can kind of explain and piece things together in such
Right.
a manner that we are utilizing things responsibly without necessarily incurring additional risk for
Right.
individuals that are suffering, right? Yeah.
Right. Would that almost be like saying you're getting your wires crossed if you're not doing it under a professional
Yeah,
supervision,
absolutely.
right?
It's like if you weren't a mechanic and all of a sudden you started tinkering with your car,
Yeah.
you're probably going to mess it up, right? So
That's
it's a
a
very simple equation, right?
right.
Yeah.
That's like a recipe for disaster, right? Like all of a
Yeah.
sudden your car starts going
All of
backwards
a
and you
sudden
want to go
you don't have
forward.
brakes, right? And it's like, oh my God. It's like, yeah, and a
Yeah.
rainy day like today, right?
Yeah.
It's
No,
like,
no.
forget about it.
Right, right, exactly, exactly. So now, when somebody sees you and they're having difficulty, and you're talking about with all the examples that you mentioned, you're talking about maybe some examples that are not as extreme to very extreme examples.
Yeah.
Can everybody recover under the supervision of a physician or a doctor like yourself that can get them,
Yeah.
I don't want to say
Danny.
fixed,
Yeah.
but
Yeah. I don't like to speak in absolutes, so you never say never, and
right, right.
you're not always going to say always, right? But for the majority of individuals, yes, there's going to be an upside, right?
Yeah,
There are some people that are harder to treat, but you know
right,
what? We're never going to give up on anybody. Quite the
right, right.
contrary. I think that that's where, again, many of the fallacies exist right now, that people don't seek out help, and then subsequently resort to the easiest exit, which is suicide in some cases, like,
Hmm.
whether it be depression, bipolar disorder, schizophrenia,
Right, right,
dementing conditions, that's tragic, right? And that
right,
should never
right.
be the case,
No.
particularly in a community like the one that we live in, right? We
Hmm.
have the availability of so many different things, and it's just dumb not to seek out help
Right,
if
right.
help is needed.
And that's the good thing about our show is sometimes we have guests like yourself that can help, and then somebody
Yeah.
who's listening to us can potentially feel the need that, hey, you know what, let me explore this. I don't know, like, you don't
Yeah.
know what you don't know sometimes, and I haven't
Right.
been feeling well.
Yeah.
Whatever, not motivated, or just something is off. Just make that phone call, and then I guess doing that then enables you to say, okay, get some guidance. Okay, yes, you need to go this route, or yes, you need to go this other route, but at least
Right.
under the supervision of somebody, where you have somebody to
Yes.
reach out to.
100%, Danny. And you just said it right now, right? Oftentimes
Yeah.
people don't know what they don't know. It's
Hmm.
different if you don't want to know what you don't know, right?
Right.
But
Yeah. Yeah.
part of what we're trying to do is make sure that people are educated about the fact that if in doubt, seek out help. It's not
Right.
difficult, right? There are resources within our community. I'll give you an example also. I helped set up the Tristan Alva Alliance, which is a nonprofit, to try to actually help individuals that are falling through the cracks of coverage and might not be able to aid themselves with the
Hmm. Hmm.
availability of, treatments like repetitive transcranial magnetic stimulation, for example. And there's a nice opportunity, and I'll send you over a link so that if somebody wants to donate to that particular cause, it's 100% tax write-off. but it's a nice way within our community also to be able to serve those individuals that are falling through the cracks, don't
Right.
necessarily have the means to help themselves, or don't know that they can actually seek out help and attention. And
Right.
also, it's a way of decreasing or creating harm reduction in individuals that might have been trying to treat themselves with the wrong thing, meaning
Right.
illicit substances. So
Hmm.
sometimes people think I got to drink alcohol or I got to use drugs to feel better. And that is the wrong approach, right? But sometimes that gets people down the wrong path, and that
Hmm.
creates additional problems for them. Now, for
Right.
those individuals that actually have coverage, groups like Pacific Neuropsychiatric Specialists, phenomenal resource, right? For people
Right.
that are
Yeah.
interested in seeking out the possibility of being a participant in a clinical research trial. Well, right in the city of Orange, we have our Center of Excellence, which I'll invite you to come to and check out, Danny. It's a really neat place where, there's a great confluence of both clinical and clinical research work that we
Right.
do.
Hmm.
And even for those individuals that don't have the means, I'm trying to actually help out with these particular things. And it's not just through medicine, right? So,
Right.
for your audience also, they might be interested in a company that I work with also called Abstracted Clarity, where we utilize
Hmm.
biofeedback to
Right.
then
Right.
help reset the brain and then subsequently help people, even professionals or athletes that want to reach an elite or peak level. There's ways of actually helping channel the brain to work for us, not against us.
Right. Right. And that's good to know that that's also available. That be able to reach that mindset, right? To be able to perform at your best.
Yeah,
So as we get ready to wrap up, what's exciting for the next 6 to 12 months?
yeah. Well, there's a lot of stuff, Danny. I'll give you an example. I work on the clinical research side of things. There's a brand new long-acting injectable that just got FDA approved to treat our patients with bipolar disorder.
Hmm.
And sometimes people want convenience. They don't want to have to remember to take a medicine on a daily basis. So if they're able to get a long-acting injectable, once a month instead of having to take their medicine every day, that
Hmm.
creates things, in a more convenient manner. For tough conditions like bipolar depression, we're about to see a new FDA approval for another medicine that is actually quite user friendly, doesn't have much of a negative downside, but has a really nice upside to it that we'll start to be able to offer our patients. So, there's a lot of really neat things coming down the horizon, which for clinicians like myself, amplify the ability for us to help out many more individuals. Just this past year, we saw a new medicine that actually helps target glutamate, which is the main excitatory neurotransmitter in our brain that's taken orally, come out to market. And that's great. And there's still a lot of doctors that don't know about these things, right? And
Hmm.
that's where it's
Right.
so important for us not only to advance the science, but to educate our peers. Part of the reason
Right.
by which I'm in Florida right now, I'm actually educating my peers because I get a chance to educate other doctors on how to be better doctors. And
Right.
it'd be selfish just to isolate things to our region. We got to spread it out to the rest of the world also.
Right, right. No, that's amazing. It looks like you're doing amazing work, and then amazing that you're able to spread that wealth of knowledge amongst your peers to be able to
Thank you, Danny.
multiply the ability to help people, right? So
Yeah.
so now if anybody who's listening to us either wants to get involved or potentially needs your help or doesn't know that they need your help but wants to even inquire, how could they get a hold of you?
Oh, that's easy. And what I'm going to do is I'm going to follow up with you and I'll shoot you all sorts of information about the different entities that I just described. ATP clinical research for those individuals that might
Mhm.
want a little bit more uh, information about what exactly clinical research entail and what's available, et cetera,
Right.
and so on. ATPCR.com is a nice, easy website. But like I said, I'll shoot you the information. For the clinical services, Pacific Neuropsychiatric Specialists, I'll shoot you that information. For the nonprofit that I've made mention of, the Tristan Alva Alliance, I'll shoot you that information. And even also Abstracted Clarity, which is the biofeedback component, I'll definitely shoot you that. So I promise you, I will send you 4 different links.
Okay, perfect. Do you have Now, we have a lot of listeners that just listen to the
Yeah.
show, not literally see it. So do you have a number that you can say that when somebody's listening to the show, they can actually write it down and make a
Yeah,
call?
yeah. So for sure, we are the easiest number that comes to mind is 714-545-5550.
Hmm.
That'll actually be an easy conduit for PNS, clinical
Okay.
services, or
Okay.
Pacific Neuropsychiatric Specialists, as well as ATP clinical research. They'll be able to actually shoot over individuals that way. And I'll make sure that they also know how to refer over to the Tristan Alva Alliance or Abstract for
Okay.
Clarity.
All
So
right. Perfect.
714-545-5550.
Very good. Very good, Dr. Alva. Thank you so much once again for coming on the show, sharing
Thank you, Dan.
your knowledge. And to our audience, please go to ocpowerplayers.com and follow us on your favorite channel. Thank you, Dr. Alva.
My pleasure. You take good care, and we'll talk soon, Danny. Thank you.
Very good. Thank you.
Thanks for listening to Orange County Power Players. Want to share your success story? Apply to be a guest at ocpowerplayers.com/guest.